and particularly the new young doctors, but we've been dealing with aesthetic complications since the late 90s, certainly in the last century. That's my biography. Because I've quite a lot of slides, I'm going to rush through this. I'll include botulinum toxin. We're so used to botulinum toxin now that I suppose we forget when it started. Doctors were really afraid of it. And I was asked to do a series of articles in the Irish Medical Times back in 2000, 2001, just to educate doctors that this is going to be the penicillin of the 21st century. And that's me being interviewed about Botox arriving in Ireland 23 years ago. Anyway, this was one of the first cases I seen, and when the patient went to the doctor unfortunately told her that this was going to be permanent. And she came to me for a second opinion, and it was just a ptosis of the upper eyelid. But at the time, I suppose, we didn't really know how to correct these things. We used iodopine, we also used phenylephrine, and believe it or not, this was one of the first patients I've seen to reverse ptosis in a blepharospasm. And we're using the same technique now to do lip lifts. So, orbicularis muscles are circular. They usually have two sections, tarsal, pretarsal. And if you isolate the lower bit, the top bit will open it. And this was that patient 1 week later. So this is hard to believe, nearly 20 years ago now. So I'll just run through the patients that came to me. Most of them are my own. Some of them are for other people. This patient, unfortunately, couldn't be corrected with Botox. I used a thread lift, and she was lifted that way. This is back in 1999. It's hard to believe, with dermal fillers. This is one of my own patients, and this was before she got married. So Nasha products originally from QMed did cause inflammatory reactions. Very easy to correct by just using some dexamethasone. This is some of the patients that I've sort of seen and been involved with, so I can flick through these. We've all seen them at this stage. This is one of my first patients over 20 years ago that we used hyaluronidase on, and I had a lot of experience with using hyaluronidase. I knew that vascular occlusions had to be used at the level of 1500 or whatever. Our colleagues in the United States were using 150, and I couldn't figure out why, but they were using Hylex, and their vials were 150 compared to ours 1500. So for me in Las Vegas many years ago saying, you got to use 10 vials, I know, to me, I was only using one vial. So this took a while to influence people. I know Claudio Di Lorenzo wrote papers later on saying the same level, 1500. So a lot of the original problems we had to change also with steroids. And these are some of the patients I've seen. This is very easy to correct. The difference was this patient had a C1 estranase angioneurotic edema problem also. So she was like this just 20 minutes later. So I had to use adrenaline on her also. This is just a bruise, bad bruise. If you use hyaluronidase here, you'll obviously make it worse. Infections. Originally, we see a lot of infections. Thankfully, the infections are from the inside out, so they're all easy to treat with our normal penicillins, augmentin, that sort of thing. Whereas, most things like acne, wound infections are gram-negative. They don't use oxygen, so they require something more. This is one of our popular fillers. I'll not mention it by name, but it caused a lot of these facial abscesses, and it's still widely used. And believe it or not, Peter and I, and I'll go into some cases in a moment, were among 3 doctors in the world that originally were using bioalchemid, and I'll show that in a moment. Sculptra originally, unfortunately, the mix was 3 mils instead of 8, and it caused all these type of problems. Now, a lot of these problems were sent to me, and some of them were sent to me from Australia all the time back then, and when we did biopsies, these were PLA crystals. These weren't collagen, and that was through St. Vincent's Hospital. So we knew the mix was wrong, that it was being injected too concentrated. I'm seeing a lot now post-COVID vaccine, a lot. I have 23 patients that I am presently treated or have treated, and these patients will not change with interlesional steroids. No matter what you see from the American Medical Association that the steroids get rid of it, they don't. Maria Landa, if she's in the audience, her and I have used different techniques, particularly the use of methotrexate, and this does treat the patients. A lot of them are presenting like this and a lot worse. I'm seeing sculpted patients from years ago presenting. So hyaluronidase and steroids have done nothing. Methotrexate does. Now, some of the patients are being left with hollows in their cheek like this, and because we don't want to use inflammatory agents to recreate the volume, I have switched over to using the deoxyribonuclease, the polynucleotides, and have been quite successful with this. So the polynucleotides will have their own aspect in medicine. They're crossing from medicine into aesthetic medicine. We've used them in wound repairs up until this. They work a totally different way. They work through with V receptors that's causing new epithelium through fibroblast stimulation rather than wound repair. Back in 2001, we had a lot of HIV patients, and the problem was that the patients being sent to us had high CD4 levels, low CD4 levels, and they were highly infective. With the old antiretroviral drugs, they caused a lot of problems. We were using Sculptra. The doctors were at risk. We had to use 5 treatments, 70 injections, so we switched over to using bioalchemate at the time. And I wrote this paper back then on it. And bioalchemate was wonderful because it was a one-off treatment. And not only that, but it removed the whole possibility of having problems. This is the first patient I injected in the United States nearly 20 years ago now. 10 years later, it created this problem. And I know Peter had some of these problems as well. And lucky enough, the way that we injected it, we were able to cut it out from these patients. But bioalchemate was later taken off the market. I'll spin through these. At the time, Das Bono given the United Nations thing to Alex Ticatino in New York. Alex was getting a prize for HIV patients. And I had contacted Alex because he had all these patients, but I discovered that none of them were on antiretroviral drugs. So at the time, we didn't know, is this a new phase of HIV, that patients are living longer and suddenly they're getting lipoatrophy, or is it the antiretroviral drugs? As it was proven, it was the antiretroviral drugs, as we speculated at the time. So these were the complications they caused before they came off the market. Canada made the first call, the Canadian Health Authority, to pull that product, and it was pulled. I was invited to Moscow early on, seeing a lot of complications from the polyacrylamides. Most of those we were able to cut out, and there are just some papers that I wrote on it. So thankfully I can spin through these pretty quickly. I started using Radiesse for atrophic acne scars, and it was wonderful. But I myself ran into problems with this patient almost before my eyes. I hit an artery, and I realized we got to stop using calcium hydroxyapatite in the presence of vascular structures. At that CFEL conference in 2007, I gave a paper saying that we should stop using them in that area. This patient, he's dead since, as you know, Pete Burns, one of our colleagues, put it in his lips. And this is the problems that Radiesse caused. And they were more in the hands of God, because there's not much you can do when it's on board. So we had a lot of these patients in that period. So I can spin through them. Mad cow disease was bad for farmers, but it was wonderful for doctors. Bird flu, terrible for patients, but wonderful for doctors, because it convinced the American dermatologists to stop using collagen. It only lasts 3 months. It's an anaphylactic source. It has the potential to come from roosters' combs or for birds. So this switched America over to hyaluronic acid fillers. I know the FDA held them up from 1996 right through until 2005 also, but it convinced our colleagues to use Hyalase. And these are a lot of the patients I've seen. And at the time, vascular occlusions started to happen big time. We think it may have been associated also with the application of lidocaine to the fillers. These are some papers that I wrote. I'd advocated the use of hyperbaric oxygen chambers, and this is my protocol for, I know my time is limited if somebody wants to run through it, but the protocol now is used internationally. So this, Michael was sent to me because he got too much fillers put in his face, and before he met the Queen, he wanted it back out. And that's a story within itself. This is Julie Bass, patient from California, nurse also, who was the first to allow her pictures to be used on the internet. And this is Julie with me and her family in Dublin many years later. I came up with some techniques for late onset and for patients that were already 2 weeks late. So what I'd said was that this whole aspect of burns or of vascular occlusions is totally different than any other wound repair. There's no blood. If there's no blood, there's no growth factors. If there's no growth factors, there's no signal messengers. So I advocated the use of using PRP and stem cells in these patients, and we totally reversed them. I probably don't want to go into it now, but the VGF cofactors obviously cause quite a red skin. So after 6 weeks, we decided to use IPL on these patients and later CO2 lasers, and we brought them all back without any problems of epidermal scarring or dermal scarring. Macrolide came and went. I was using it in complex cases like pectus excavatum quite successfully, but it was taken off the market. This was the early days. We were using 5-fluorouracil or dexamethasone for sub-Q. Sub-Q was taken off the market. You can see the difference in dexamethasone on one side and 5-fluorouracil on the other. And this was the era of biofilms. And I had advocated that if biofilms existed, you had a situation where you had hyaluronic acid surrounded by a collagen matrix, surrounded by bacteria. So you had to triple hit it, both with hyaluronidase, something to break down the collagen, usually interlesional steroids, and then Clasid on top of it, or whatever your choice. Clasid went into disfavor a bit with tendinopathies afterwards. So these are a lot of the early, I suppose, lectures in IMCAS. This is a patient who had presented with silicone. We mentioned it earlier. She had a complex, I suppose, craniopathological reaction. She needed some of our colleagues in the craniofacial unit in Los Angeles to restore a new forehead. And this is her with me when I did the Royal Society of Medicine. The other patient also, both of these patients have hemifacial transplants now with their autologous rather than coming from another source. In Las Vegas, we come up with the protocols of using, I suppose, hyaluronidase in the bigger concentrations. This is a patient from the Carolines Institute. I'm not supposed to mention her because the court case is finished, and I'm only mentioning her for a different reason. She unfortunately got blindness, and we were going to attempt to use stem cells on her to restore her sight. We think of the heart and the eyes as something special, but at the end of the day, they're not. They're just another organ. So if we're able to restore myocardial tissue by the use of stem cells, there's no real reason why we cannot also maybe restore retinal cells. So we had her set up to go to Miami. This patient then, unfortunately, with stem cells were used on her in Miami, but she was just a multiple sclerosis. And we know multiple sclerosis comes and goes, so they decided, let's not do it in Miami. So Alan Skupin was going to do it for me in the Dominican Republic, and then, unfortunately, Paolo Maccini, one of the doctors from the Caroline Institute, gave false information regarding his stem cells. 3 of his patients had died, and we'll not go into it. It was a scandal at the time. So the Caroline Institute pulled out as well. So that's me on time, I think. This is a book that I've written recently on the evolution of aesthetic medicine. You probably can get it on Amazon. And I'm within time. Maybe I went too far.